under your purview, like what are your main responsibilities if you're the CMO of Metro Health, University of Michigan?
Well, the Chief Medical Officer's responsibility is to really run the medical care in the hospital.
Mm-hmm.
So I try to start most mornings through the emergency room, maybe 6 or 6:30 in the morning, talk to the staff, the nurses, the physicians, the therapists, the ward clerks, see how their night went, how the day's looking. And then from there, I usually then go to the preoperative area where everybody's coming in for their surgical procedures, talk to all the staff there, and then upstairs, I'll start in the ICU and go to the floors. And it's kind of nice to be there right around shift change because you can hear the nurses who are leaving, find out what their challenges were overnight, and then talk to the nurses during the day so that we maybe help address some of those concerns that they will have to take care of. And, the nice thing I found that by rounding myself, I can, number one, determine the problem exactly what it is.
Yeah.
Because if I wait for it to come to my office, number one, I'm not sure what it is. It's filtered by 12 people. Number two, it's a disaster.
Right. Yeah.
So if I can take care of it, know what it is, take care of it immediately, or help someone take care of it, then really it's much easier, much prompter. It's better for patient care, and certainly engenders the support of all the people in the hospital, all the staff. And
Sure.
for them to know that their chief medical officer has got their back and is in this with them.
Well, I'm sure you have a nice office, but the point that you spend the first couple hours of your day on essentially a listening tour,
Yeah, sure.
is impactful, I'm sure, for everybody, because you're not somebody that they only see when something horrible happened and major changes need to be made quickly. You're embedded with the team, so to speak.
Yeah, too many times an administrator or another suit, so to speak, they show up on the floor, okay, what's wrong, why are they here?
Right.
Whereas, fortunately enough, being there for 2 years, when I'm on the floors, some of the nurses and therapists will come up and say, hey, Dr. Grifka, here's what I saw, or here's what I did, or here's the issue I have.
Mm-hmm.
So the fact that now they're comfortable coming up to me and knowing I'm there to help work through problems with them and hear their successes, too. I mean, I like that just as much as the problems.
Yeah, and you can interface with some families, ask how they're doing.
Sure.
You get the full breadth of doing that tour from ER to OR to ICU to everywhere else.
I find it quite helpful to do it on the weekends also. Things are a little relaxed because there's not so many scheduled procedures.
Right.
People have a bit more time. They're a bit more open with their thoughts and really can learn an awful lot on Saturday or Sunday rounding.
The Full Exposure Podcast is brought to you by Metro Health, University of Michigan Health, and Dr. Peter Hahn, in appreciation of the creative and artistic visionaries who enrich our lives through cultural connections.